What's up, guys? It's Nurse Blake here, and I just wanted to take a few moments to share with you tips for a successful interview. This is a critical part of your nursing journey, and it's always good to have some things in your back pocket whenever it comes to interviewing. So I've been in healthcare since I was 17 years old. I've worked as a patient transporter. That was my first job in healthcare. It was so much fun being able to really have a good time with the patients, race them down the hallways. And I would just go all over the place. I had friends throughout the whole hospital. It was so much fun. And then after that, I got a job as a surgical assistant where I helped prep the ORs and then also clean them up, after the procedure was done. And then I got a job in the neuro ICU as a patient care tech. I worked along with some of the coolest nurses, and it was a really good experience because I was going to nursing school and also learning so much at the bedside. Graduated nursing school, and then I've held 3 nursing jobs since then. So I've had my share of interviews. At first, I was so nervous, but through each and every one I've had, I've gotten a lot of practice and a lot of experience, and that's what I wanted to share with you guys today. Tips that I've learned, failures, successes that I've had in my interviews that'll help empower you when you go in for your next nursing interview. So let's start off by being yourself. This is one of the most easiest things to say, but one of the hardest things to do. Because a lot of times you could be nervous in the interview, feel uncomfortable, but it's all about the first 5 minutes kind of breaking that ice. So smile, laugh, tell a joke, share a personal story. I don't care, talk about the weather outside. Use this time to really get yourself comfortable, and it will also help the people on the other side of the table be comfortable too. And then be yourself, just be you. The people who are interviewing you, they were in your shoes before, so try to not let them really intimidate you. And really, they're just looking for someone who's authentic and that could be with their patients and also the team and really fit in with the group. So definitely be yourself and don't be over-rehearsed or over-practice. Do your research. And what this means is do your research on the organization and unit you're applying for. Every organization has a mission, goal, and vision, and you guys should know these and understand these before you're going into the interview, because you could use a little bit of their mission and vision as some of your talking points. They may say, how do you know about the organization? And you'll be able to give some feedback and share knowledge that you've already done research on. And then do research on your unit. What do they specialize in? Have they received any awards? Are they magnet accredited? And this will also help you score some brownie points. So do your research on the organization and unit that you're applying for. This is the fun part. And this is something you should always have, and you could really start building this in nursing school. And it is your own personal portfolio about your experiences in school and also jobs. So mine's a little boring, but you could dress yours up a little bit and really show your personality. And make sure you have a few of these, because after every interview, you should leave it behind and give it to the person interviewing you so they can show their team, and it'll also be something that they'll be able to remember you by. So in a portfolio, again, have fun. This should be a lot of fun to make one of these. And you'll be able to, after you're done making it, you'll be able to see all the work you have accomplished, and it will help you feel more confident going into that interview. So in the portfolio, always have your resume first, and then have a list of references, and also throw a few recommendation letters in there. That always makes you look really good. Followed by that should be your certifications. So you can have your nursing license in there, your PALS, your CPR, your ACLS. Make sure you include those certifications in here because it'll really make you stand out. After that, you should have any cool research you've done or any papers you've written, followed by community service that you've done in school or outside of school, and then show a list of any professional organizations you've been in. And what's great about this is even if you forget about one of your accomplishments, you could reference it in the interview and go through it with them. This is what I did really cool. I participated in this nursing organization. I volunteered here at this point. And really, it should be something that showcases you and that you'll be able to show off a little bit. Remember, leave this with them. This will be something that they'll be able to remember you by and also reference it back. And they'll also share it with the other team members so they can get a glimpse of what their future coworker is going to be like. So have a portfolio, have about 5 or 6 of these. Take them to every interview you have. So again, in the portfolio should be your resume, your references and recommendation letters, certifications. So PALS, CPR, ACLS, CCRN. You should have any cool research or papers you've written, and this could be things you did in school or outside of school. Any volunteer service or community service you've done, and also any membership to professional organizations you're in, make sure to include those. Keywords. Remember and note some keywords that you want to remember and say and bring up during your interview. And a list of my recommendations are teamwork and collaboration, because as a nurse, you have to work with different departments. So definitely throw those words in through your interview. Effective and efficient. Healthcare organizations want to know that you're effective in your work, that you're responsible, and you're also efficient. Also mention cultural competent care and also patient-centered care. They're really like those. So any types of words that you have that you want to remember and reference or bring up during your interview, make a list, try to remember them, jot them down on some notes. And again, my recommendations are words like cultural competent care, patient-centered care, teamwork, collaboration, responsible, effective, and efficient. And just bringing those up throughout your interview will make you sound pretty good. So practice interview questions. You could check out the website nurseblake.com and reference the Tips for a Successful Interview article, and you'll be able to see a list of some examples that I have. With interview questions, always start with the beginning, a middle, and an end, and make sure you always end every answer with something positive, because you always want to leave them on a positive note. And then silence is okay. It's okay to take your breath and relax and really think about your answer before it starts coming out of your mouth. So silence is okay. Don't be scared of silence. So I think there's 3 types of questions that are asked in interviews. One are pretty generic. Things like, tell me about yourself. Why did you get into nursing? And then the second type of question is a little more specific, where they want specific examples shared about your past experience. So that would be like, describe a time when you disagreed with your coworker, and how is that issue resolved? Questions like this, they want specifics. Don't make your answer too short, and then don't drag it out either. Start it with the beginning, middle, and end, and always end on a positive note. Another example of these specific questions would be, explain a time when you went above and beyond your basic responsibilities. Another one, collaboration is key in healthcare. Explain a time when you collaborated with others. What was the situation and outcome? And the last one for this specific, here we inspire innovation. Describe a time when you had to be innovative. All right, so these are specific questions that really demand specific answers. And like I said, silence is okay. Take your time to really think about the question, always beginning, middle, and end, and always end on a positive note. The third types of questions they ask in interviews are unit specific or specialty specific. So obviously do some research on the unit you're working on, whether that be surgery, OB, med-surg, ICU, neuro, all right? Know the content and know what types of patients those are going to be and what types of healthcare issues those patients on your unit are going to have. Because they may ask you specific questions about the care of those patients, and that's something you should know. If they ask you why you're getting into neuro, you can't just say, oh, because I saw it online and I just applied because I need a job. All right, know the details about the specialty that you're applying for. Now it's your turn to ask questions, and please do ask questions. It shows that you're interested, that you want dialogue, and not that you're just out there looking for a job. All right, so ask about the nurse-patient ratio. What does the orientation process look like? Any opportunities to participate in a unit practice council? And then always ask when you should expect to hear from them after the interview. And always follow up. So after you leave your interview and you get back home and you relax, don't forget to send an email to the HR coordinator and also the people interviewing you and thank them for their time away from the bedside or away from their office to spend with you to get to know a little more about you, to see if you'd be a good fit for their team. So always write a thank you letter. If there's anything that you forgot to say or mention, you could also include this. So this is kind of your second chance to be in their ear, to share with them things that you did forget that you want them to remember. And then if you were supposed to hear from them in 3 days, but it's been 4 days and you're getting anxious, go ahead, pick up the phone. It's okay. Write them a friendly email, just a reminder that you wanted a status update. All right? It's okay to do that. It's okay to follow up with them, especially if an expectation of 3 days was set. And then practice. This is key. But it also needs to be balanced. Don't get practice confused with over-rehearsed, because during your interview, it's about being yourself. It's not about you sounding over-rehearsed or being stiff. The whole interview is about being genuine, and practice is about being able to slow down, anticipate some questions, some keywords you want to say. Practicing just makes you reflect on your career and journey you've had so far, and to kind of put all your thoughts together to go in and take to the interview. So practice with a family member, practice with a friend, practice doing your introduction, answering some sample questions, put together your portfolio, practice asking someone else questions. So practice is definitely key, but it's also a good balance. Like I said, you never want to sound over-rehearsed. So thank you guys so much for listening. You have this. All right. It's all about showcasing yourself and really sharing with them your accomplishments and your goals in life. So enjoy the process. You got this. Please share with me your experiences. I want to hear your feedback. Let me know how it goes and if these tips really helped you. So thank you guys so much for listening. Be sure to share it with all your other nursing friends. And then don't forget to follow Nurse Blake. You can find me on Facebook, Instagram, Twitter, and you could also check out more content on nurseblake.com.